It takes a special brand of gumption to volunteer in the so-called Ebola hot zone, so it should come as no surprise that a nurse who spent a month in Sierra Leone is not backing down in her fight against a mandatory quarantine. Casey Hickox is at home in Fort Kent, Maine, after fighting for release from a tent in a New Jersey hospital parking lot. Now she says she won't comply with a directive from Maine officials to remain inside her home. Hickox tested negative for Ebola twice and has no symptoms. It's a similar scenario in Connecticut, where 9 people have been ordered to stay in their homes, including a Yale student back from Liberia who is showing no signs of the disease. Connecticut is one of a growing number of states taking steps that go beyond the CDC's recommendations for containing Ebola. And Defense Secretary Chuck Hagel announced today that all military personnel returning from West Africa will be subject to a 21-day quarantine.
This is also a policy that was discussed in great detail by the communities, by the families of our military men and women, and they very much wanted a safety valve on this.
My next guest is a vocal critic of mandatory quarantines imposed on people who are asymptomatic, and he knows firsthand about the danger Ebola poses. Dr. Richard Sacra became infected with the deadly virus during a mission trip to Liberia. He was declared Ebola-free in late September and is now back home with his wife in Holden. Welcome to Greater Boston. You look great, nonetheless worse for the wear.
I feel good.
Good. So I have to ask what everybody's most curious about, and that is, what does it feel like? What's it most similar to? Is it like a bad flu? How did you feel?
Just a really bad flu, high fever for the first several days, and then vomiting and diarrhea.
Did you feel delirious at all?
I had a little period of time right around the time when I got to Nebraska when I was kind of out of it.
Yeah, because that's where you were treated. Did you have any of the other symptoms? There's this awful, hideous rash that comes with it. There's internal, external bleeding. Did you have any of those?
I never reached the stage of any kind of bleeding or organ failure or anything like that. So I'm thankful for that.
Now, you were actually treating a pregnant woman in Liberia. How do they think you contracted it?
Well, this was one of the issues, and I think why we've seen a lot of healthcare workers in West Africa coming down with Ebola, is that this epidemic is so big and so complicated that you have people coming in who are ill but who may not have all the classic signs and symptoms. So we were dealing with full-term pregnancies, women who had sometimes been in labor for 3, 4, 5 days, 6 days, because all the healthcare facilities were closed in Monrovia at the time. So when they finally got to us, they're very sick, they need an operation, and you just don't see all the classic indicators. They didn't have a high fever and vomiting and diarrhea. So she was probably
infected. Did she live or die?
Well, we had several. I actually don't know which patient it was who I got Ebola from. We had several that were so ill when they arrived that they didn't make it, and I'm sure it was one of them.
Well, were you frightened? Did you feel like you were going to make it because you were going to get back here to the United States, or was there a moment when you thought, you know what, I could be one of the 50% that doesn't make it?
I had a great sense of peace and calm, and I think that comes from my faith, just trusting God that He had me over there for a good purpose and He was going to take care of me. I was concerned for my family. I knew it was putting my wife and kids through a lot, the worry and the strain and of me having this.
At what point did you start to feel better? Did you feel like you turned the corner after you got to Nebraska?
Probably about 5 or 6 days in, I started really, being able to keep down some food, being able to walk around the room a little bit.
So what is your take on all this quarantine stuff now? Casey Hickox, who was kept in the tent for 5 days, and now she's being guarded in her own home by state police. States are kind of doing this state by state. CDC sent out some guidelines, but states can basically do what they want.
Right. I just think people need to keep the science in mind here, the facts in mind, and the fact is a person with no symptoms cannot transmit the virus. So we've got these people with no symptoms being told they have to remain indoors and can't even take a stroll on the street when there's really no risk to anyone. And I think it's unfortunate. I think it could have a chilling effect on encouraging volunteers to go over there if they have to have 3 weeks that are totally lost. They can't even take a stroll. I think there could be some compromises in between. More active monitoring, you know, even a call or a visit from a public health official a couple times a day to check on how you are.
They are doing that, but they're also keeping her in.
Right, right. But you know, why can't somebody with no symptoms go, you know, go through the drive-through and pick up a...
Yeah, she's fighting it. She's going to sue the state. So what's happening in Liberia now? We had Dr. Jeffrey Drazen on last night from the New England Journal of Medicine, said that things are better in both Sierra Leone and Liberia. But what's the healthcare situation on the ground? You said that, like in Monrovia, some of the healthcare centers are shut down. Are they still?
Many of them are still struggling to get reopened. Many healthcare workers, you know, we've lost a fair number to Ebola, about 100 in Liberia. Many are understandably reluctant to come to work because they're concerned. Some of the healthcare, you know, if an individual in the hospital gets sick, then they have to close down the hospital to decontaminate and clean, and it takes a while to get things reopened. So many hospitals are closed right now.
So we're like regular daycare, especially pregnant women and that kind of thing. It's just, there's a backup. What are they doing? What happens?
Right. So you have a lot of people, they're driving all over town, going from facility to facility, trying to find out where they can get care. I think it's still very, very difficult. And, you know, we do hear that the Ebola treatment centers now have a little more space. So that's better. At least you don't have Ebola patients laying on the street waiting to get into a facility. So that's good news. And you know, it's still going to take a lot of effort from a lot of people. We need a lot of volunteers to help rebuild that health system. All
right. So you said that in 40 years, no one has recaught the Ebola virus. So you're good to go. Will you go back to help people now that you can't get it again?
I'm hoping to be able to go back early next year and spend another month helping out at SIM's hospital that I work at in Liberia. Yeah. And
why were you there in the first place? Were you there because of Ebola, or?
No, I actually have lived in Liberia for many years. I went over in '95, came back in 2010. So I've spent 15 years there. My kids grew up there. It's really a second home for us.
Were you there all during the Civil War and everything?
We had a couple of evacuations during the war years. So we really are, you know, we have dear friends there. We're connected there, and I really see myself as, you know, pitching in to help as much as I can. All
right. Well, we'd like to stay in touch. So much for coming, Dr. Richard Sacra.
Well, thank you for having me.
Pleasure to have you. All right. Well, last night we took on another controversial issue, the prosecution of Robel Philippos, who was accused of lying to federal agents investigating the Boston Marathon bombing. We asked what you think about his conviction. And George kept his thoughts short and sweet. Justice was served. Nancy disagrees, writing, charging this young man in federal court was like taking a hammer to a gnat. Let's hope the judge is merciful. And Steve calls the verdict an abomination. Thanks to everyone who weighed in.